So again, on behalf of Center for Change, we want to welcome you to our very informative and interactive event this evening. We have a moment with Dr. Cynthia Page. What you should know about diabetes is going to be learning the effects of stress on diabetes. What does stress have to do with making your numbers get higher? What does your diet have to do? What are the ABCs and why are they so important? What about exercise and a lot more? Okay, so stay with us because I'm sure you'll hear something that will resonate with you or someone you love. Before we go any further, we wanted you to make sure you got those pre-questions answered. And if you have, we are ready to begin. That was easy, wasn't it? Hi, everyone. I'm Monica May, and I have the privilege this evening of being your moderator. Here's something personal about me. I am a type 2 diabetic. So this is going to be very, very good information for me. Our doctor this evening is Cynthia Page. She's a board-certified family physician at Dedicated Senior Medical Center here in Orlando. Now, while they may be new to our area, Dr. Page has over 20 years of academic experience at New Jersey Medical School, and she completed faculty development fellowship at UNC Chapel Hill. She also has an MBA from the University of Tennessee. Here's some more backstory about our good doctor this evening. From 2011 to 2018, Dr. Page was president of the New Jersey Medical Association, the state chapter of the National Medical Association, which addresses the unique interests of us, of African-American patients, as well as physicians. She serves on several boards of trustees, including the Board of Trustees of the National Medical Association, and she was elected their chair just this year. Dr. Page is the author of several publications. She's been featured on the Black Experience television program, the Tavis Smiley radio show. She's received numerous awards from the likes of the YMCA, the National Council of Negro Women, the Student National Medical Association, and the American Association of Medical Colleges, just to name a few, all for her commitment to educational excellence and community service. So I'd say we're definitely in good hands tonight. So let's welcome Dr. Cynthia Page and begin our presentation.
Thank you so much, Mrs. May. It is a pleasure and an honor to be with you tonight. We are going to talk about such a pertinent disease that affects millions of Americans and many people within the state of Florida and the city of Orlando, the county of and Orange County. So let's get started. Let's not waste time, and we will leave time for questions. Please use the chat if you have questions so that when we get to our question slides, we'll be able to answer your questions. So let's get started. So diabetes has several types. There's type 1 diabetes, which traditionally was called juvenile diabetes because it typically begins in younger people. However, we can see it in people into their 20s and 30s as well. And sometimes it's very mild and we don't catch it until people are in their 30s. The most common type of diabetes is type 2 diabetes, and type 2 diabetes was traditionally called adult onset diabetes. However, with the onslaught of obesity, we are seeing diabetes, adult onset diabetes in children. And so we typically call it diabetes type 2. Next, there's gestational diabetes, which occurs in pregnancy. So many women who are pregnant develop diabetes. We screen women for diabetes starting in the first trimester and all the way through into the second trimester. When a woman develops gestational diabetes, she is at increased risk of developing type 2 diabetes later in life. Lastly, there's prediabetes. So prior to someone becoming a diabetic, many times the blood sugar is rising and the body just cannot manage the glucose load in the body. And so we test this with a test called the A1C, and we'll talk more about that in our subsequent slides. The risk factors. So what are the risk factors for diabetes? Who gets diabetes? Traditionally, as I said, it's people 45 and older. However, we're starting to see children with type 2 diabetes. Race and ethnicity plays a role as well. African Americans, Latinos, Americans, Native Americans also develop type 2 diabetes at a higher rate than other populations. Next, there's family history. So if your parents develop diabetes, there's an increased risk that you will also have diabetes. Most importantly is your weight. There's something called the BMI, or the body mass index. The body mass index compares your height to your weight. And if you are wider than you should be for your height, then that puts you into the classification of obesity, or morbid obesity, supermorbid obesity. When the BMI is over 30, that's considered obesity, and that dramatically increases your risk for diabetes. Your level of activity also plays a role, and we'll talk more about this later. So the more active you are, the lower your blood sugar will be in general. So let's talk about race and ethnicity. If we look at this pie chart, when we look at the biggest portion of the chart, that's American Indian, what we call Native American, Alaskan natives, 14.7% of that population have diabetes. Next in line are African Americans. African Americans, 11.7% of African Americans have diabetes. For Hispanics, Latino, 12.5%, then Asian Americans, 9.2%, and the lowest prevalence is in whites, which is 7.5%. So let's see if there are any questions. We just don't handle the poisons, right? And I consider the poisons an excess of glucose, an excess of carbohydrates. We don't handle the poisons well. So our bodies are not geared to have that much glucose load. And so for whatever reason, genetically and within nature, African Americans, Latinos, Asian Americans are at higher risk than white population or Caucasian population. What's interesting is you have to look at body type, right? So a lot of this has to do with how your body type is, and that again is based on genetics. So if you have a predisposition to develop a lot of weight in your midsection, that increases your risk for diabetes. We call that truncal obesity. So the arms and legs may be relatively thin, but most of the weight sits between your chest and your hips, and that dramatically increases your risk for diabetes. All completely genetically determined.
So if genetics are the big thing, what can we do about that, if anything?
We can't do anything about genetics. So what we do is we understand that we are genetically predisposed to having certain diseases. So for example, my mother has diabetes. My mother is smaller than I am, but strong family history of diabetes. Both of her parents had diabetes. Most of her siblings had diabetes. I know that if I were to get into that overweight category or obese category, I'm a shoo-in for diabetes. So it's a matter of fighting your genetics, right? So if you know you're predisposed to it, then it's a matter of maintaining your ideal body weight, reducing your carbohydrate load, and we'll talk more about that later, and just really staying active. Those are the key main factors for trying to prevent diabetes, even though your genetics may be setting you up for it.
Education is key. Because in conversation, we have to communicate with our elders And our
Absolutely.
elders have to share genetics and history and what they know to be the right ways to eat. And that's where our education comes in from our doctors who look just like us, because it's very important. You don't know what you don't know.
That's right. That's right.
And in our histories for both Blacks and Hispanics, we load up on the rices, we load up on the sugary sweets, we load up on all things that you were just talking about. So, okay, all right. So one person says, I have a lot of swelling in my legs. What can I do about it?
Well, that's a little different from diabetes, but similar in one way. So we retain fluid in our bodies whenever there's a lot of sugar, starch, and salt. So those are the things that are going to make you puffy, right? And so I call it like the Pillsbury Doughboy. And so if you are eating starch, if you're eating those Pillsbury dough things, you're going to retain fluid. And so with swelling, you have to reduce sugar, salt, and starch in your diet to reduce the swelling or that increase of fluid retention. And again, that's very similar to diabetes in the sense that the sugar and the starch are leading to an increase in your blood sugar.
And Tisha wants to know, what if the weight is all in your bottom?
You're lucky.
So is that a sign? Is that a setup?
That is actually a better thing, right? So as for women, right? So if you're looking at women, once we get into past puberty, right? So if you look at boys and girls pre-pubertal, everybody's up and down. Once estrogen comes into play at puberty and testosterone comes into play, the body shape changes. So for most women, right, and girls, right, as estrogen increases, the waistline goes in, right? So you get this sort of curvy shape. If the shape stays that way, right, and you have a small waistline, bigger hips and bottom, we call that a pear shape. A pear shape is less predisposed to diabetes than what we call the apple shape. The apple shape is shaped like an apple, right? And so, however, and again, this is genetically predisposed. However, you can overcome your genetic gift, right? So say you are that pear shape with a big bottom, but everything else started getting bigger as well, then you're just going to go into diabetes anyway, because you overloaded your genetic blessing, right? And so the key is keep the waistline as small as possible. You will reduce your risk of diabetes. For men, once the testosterone comes into play, they get a V shape, right? The shoulders get bigger and they get smaller in the midsection. Then comes the beer and the excess of carbohydrates, and we call that the beer belly, right? And so once they begin to get a belly that's bigger than their chest, they are also at increased risk of diabetes.
Fellas, I need you to hear that one. And incidentally, Miss Tisha says she's fine. Her numbers are good. She's shaped like a pear.
All right.
Let's continue on.
Okay, so let's keep going with our presentation. So what are the common symptoms of diabetes? Frequently, what you will see is urinary frequency. So you're going to the bathroom all of the time for no reason. You think, well, maybe it's because I'm drinking a lot, and you are drinking a lot. Once your blood sugar goes up, you're going to become more thirsty. The problem is if you become more thirsty and you're drinking sweet drinks, you're just compounding the problem. If you become more thirsty and you're drinking water, not quite as bad. But once your blood sugar goes up, your body's going to try to fix it. And so you're going to urinate more frequently. And the reason you're urinating more frequently is because there's glucose or sugar in the urine. Your body is trying to help you. It's trying to get rid of all of this sugar that you've taken in, that your carbohydrates, again, become sugar. And we'll talk about that. And so you're really, really urinating. And then you're also very thirsty because your blood is so sweet and your body's trying to dilute the sweetness. So it's making you drink fluids, and it's hoping that you're drinking water. If you're drinking soda, it's a major problem. You're just complicating the issue. Your hunger increases. However, when your blood sugar is markedly elevated, we're talking like your blood sugar is going into 300, 400, then what's happening actually is that you're losing weight. So despite the fact that you're eating excessively, your blood sugar is really high, people drop weight dramatically at this point when the blood sugar is dramatically out of control. There's a lot of fatigue, there's blurred vision because the sugar is also bringing fluid into your eyes. There's slow healing. Your tissue does not need sugar, right? So sugar is poison to your system. If I gave you a box of candy every single day and I told you to eat that box of candy every single day, I could rot your teeth out in 6 months, at least, maybe a year. And so sugar causes decay. And so within your entire body, sugar is causing decay. And we'll talk about that when we talk about what organs are affected by this high blood sugar. In addition, we talked about the weight loss, and then there's the tingling, the pain, and the numbness in the hands that occurs. And again, because sugar is causing decay, not only of the nerves, but also of your blood vessels. So let's look at what organs are affected by a high blood sugar. So your heart gets affected because when your blood sugar is high, it actually accelerates what we call atherosclerosis. Atherosclerosis is where your arteries get clogged with cholesterol and plaque, and tobacco accelerates this, and so does sugar. And so that's why every diabetic is being placed on a medication to lower the cholesterol, because we know that just having diabetes dramatically increases your risk of having heart disease. So there's increased risk of heart disease. The kidneys are one of your most delicate organs. Hypertension and diabetes damage the kidneys and are the number 1 and 2 reasons for kidney failure. And so when that sugar is going up, again, the blood supply to the kidneys is not going to be adequate because we're causing atherosclerosis, or the clogging of the arteries in that main artery. When you see that renal artery, that's the main blood supply to the kidneys, and that gets affected by a high blood sugar. When we go across the top row, yeast, we get a lot of yeast infections. Yeast loves sugar. So if we were going to ferment something, right? If we're fermenting alcohol, if we're making some of the friendship cakes, right? If anyone has ever made a friendship cake, there has to be yeast in there. And every, few days you're putting more sugar. Yeast lives on sugar. So when your blood sugar is elevated, yeast thrives. And that happens because that's just what they love. And so that yeast can be in various parts of your body. It can be in the vagina for women. It can be on the penis for men, where they get what we call balanitis. It can be in any area where your skin touches skin. So if there are folds in the skin, it's dark, it's warm, it's moist, and yeast loves that environment. You put some sugar on top of it, and we have a lot of yeast infections, even in the mouth as well. Your eyes are also extremely delicate. We look at something called retinal disease, and retinal disease is the back of the eye. On the left side of the picture of the eye, we see the forefront of the eye. That's the part of the eye you see when you look at someone. Behind that orange part is called the retina. And the retina is very delicate. And this is the only part of the body where we can actually look directly at blood vessels. So this is the importance of going for that annual eye exam, because your optometrist, your ophthalmologist, or even in some of our offices as well, we do eye exams where we look at the back of your eyes, and we're looking for damage to that area caused by diabetes. Diabetes can cause blindness. Fortunately, at least I'm from New Jersey and I moved to Florida, and, I would speak to different ophthalmologists, and they were seeing far less blindness as a result of diabetes. And that's because we were getting that A1C, the measure of your blood sugar, down where it needs to be. Next, we go over to the leg and the foot. Diabetes damages the arteries, damages the nerves. So there's numbness, there's tingling. If you can't feel what's in your shoe, for example, if you put on a shoe and you're young and healthy and your foot is fine, you put on a shoe and there's like a little grain of sand in there. You can feel that and you take it out and you dump out your shoe. With diabetes, you lose the ability to do that. So you can no longer feel that there's a little grain of sand in your shoe. And so you walk all day on that little grain of whatever it is in your shoe. By the end of the day, there's a blister, the skin has opened up. If there's no good blood supply, the body can't heal itself. So wounds don't heal well with diabetes because of the high sugar. It just will not heal well. And if you add on top of that an impaired blood supply, because again, diabetes rapidly increases your risk of atherosclerosis. That's the clogging of your arteries. So if there's no blood supply, you didn't have enough nerve sensation to realize there was something in your foot, in your shoe. You put that all together, and then you have a diabetic foot ulcer. Diabetic foot ulcers are the #1 cause of amputations. Amputations usually start with amputation of the great toe. That's the area where the blood has to go the farthest in order to supply blood supply to that tissue. So most of the time, the first part of the foot that's amputated is the big toe. If the forefoot doesn't heal at that point, meaning your other 4 toes, then there's amputation of the forefoot. Then if that doesn't heal, then there's amputation, what we call below the knee. We want to prevent all of that. It is 100% preventable. You have to control the diabetes. Lastly, COVID-19. We realized with COVID-19 that people with diabetes and obesity were suffering far more than people who did not have diabetes and obesity. So just having that combination also increases your risk for COVID infection. So if you have diabetes, if you have obesity, have morbid obesity, and you have not had your vaccine, as it relates to obesity and diabetes. So that's my take and my issue as it relates to diabetes and the COVID vaccine.
Mm-hmm. I wanted to just jump on with some of the questions that have come up, Dr. Page. This is good. This is really good. This person says, I have a number of the symptoms. However, my A1C remains at 5.7, and we'll talk about A1C. What else could cause frequent urination, the thirst, the numbness, and the tingling? What else could that be?
It can still be diabetes. Pay attention to what you eat that causes this. So, when I started, I talked about my increased risk for developing diabetes. I know if I have a sugar load, if I eat dessert and I have just a lot of sugar, I know that my mouth is going to get dry. Usually it doesn't get all the way to increased frequency of urination, but when my mouth gets dry, I know that my blood sugar went up. And so even without diabetes, I know that, okay, I can't do that. Other people can do that. Other people can eat whatever they want. Mm-hmm. I can't do that because I know that I'm at increased risk for diabetes, and I begin to have symptoms that my blood sugar is rising. So even at an A1C of 5.7, pay attention to what you're eating that might be triggering those symptoms, because it may just be that you had a high sugar load that day, didn't realize it, and then you're starting to have the symptoms, which means you stay away from those foods and substances that cause that. Just pay, and I absolutely love that your A1C is 5.7 and you're paying attention to your symptoms, because that's what you want to do for the rest of your life. That's how you control diabetes, eliminate diabetes, is by being very aware of your body and understanding your body.
That A1C, let's talk about that. Let's put a pin right there and really, really, really talk about that. Why do we need to have our A1C checked? How often should we have it checked? Is it checked and we don't know it? Do we have discussions about it with our doctor?
Mm-hmm. You need to check with diabetes, you need to check your A1C every 3 months. So the A1C is, the long term is hemoglobin A1C. The A1C tells us how your sugar has been for the past 3 months. And the test actually looks at your red blood cells, and it looks at how much sugar is coating your red blood cell. The red blood cell lives for 90 to 120 days, which is why we can tell what happened 3 months ago or over the past 3 months when we look at your A1C. So that's truly that measure of how well controlled your diabetes is. When you come in and we do a finger stick, that tells me how your sugar is at that moment. It tells me pretty much what happened in the past, maybe 8 to 12 hours. But the A1C is telling me what happened in the past 3 months. And we'll talk about, and this is good, we won't have to talk that much when we get to that slide. So it just tells me what your sugar control is. You need to always know what your A1C is. When you go in, if you're a diabetic and you're speaking with your doctor, ask them, what is your A1C? Write that number down and then challenge yourself, right? And so if that A1C and if you have diabetes and your A1C is over 7, then you say, okay, let me see how I can get my A1C down. Work with your physician to get your A1C lower.
Mm-hmm. Should a person with diabetes eliminate certain food groups to keep their numbers low? And is that healthy?
You will eliminate certain foods. And so, this is great. I'll get to those slides and I'll zoom by. So the key is, my mantra for diabetes and really in health in general, maintaining your ideal body weight, it's vegetables and protein, vegetables and protein. So you want to look like you are walking around the woods. You do not want to look like you are walking around the supermarket. So if you're walking around the woods, what do you see in the woods? You come up against a lot of greenery, maybe some nuts, maybe some berries. You might dig out some root vegetables. To get protein, right? To get protein, you're going to have to expend animal protein. You're going to have to expend a little bit of energy, right? You're going to have to catch a squirrel or catch a fish, so it's going to take you some energy, right? So you're going to be burning calories just trying to get animal protein. But the mainstay of your diet will be vegetables. And if the mainstay of your diet is vegetables, you will be a dramatically healthier person. So that's walking around the woods. Walking around the supermarket. So if you're walking around the supermarket and you're going up and down the aisles, you are going to look like you're going up and down the aisle. So in the aisles, you have the flour, the sugar, the chips, the juice, the soda. I'm trying to think what's in the aisles because I try to stay out of the aisles. If you can stay in the perimeter of the supermarket, you'll be much healthier as well. So if you go into the supermarket and 50% of the time that you're in the supermarket, you're in the produce section, you're great. And then you're going to go. And so the reason the perimeter is safer is because the perimeter is refrigerated, right? Those are the real foods. Those are the foods that will perish if they're not refrigerated. The foods up and down the aisles, you might have an earthquake and you could probably still eat that 10 years later. It's fine, right? And it's over processed, it's high in sugar, high in artificial ingredients. And so you want to spend most of your time in the refrigerator, in the supermarket, in the refrigerated section of the supermarket. So let's think, right? You walk into the supermarket, there's a produce section, right? You go to the produce section, you walk to the back, there's the fish and meat and dairy. And then you go around to the other side, there might be frozen foods over there, right? So fresh vegetables and things like that, or frozen vegetables that are relatively fresh. And then you check out, right? But if you go up and down the aisles, then you're coming in contact with a lot of processed foods, a lot of high carbohydrate foods, what we call glycemic load, right? So foods that will raise your sugar. And so the key is to stay away from foods that will raise your sugar.
So when you shop now, you got to remember that stay around the outside of the store. So
that's right. If you need to run in and get some olive oil, run in and get some olive oil, coconut oil, run in and get some coconut oil, get out, run in and get some spices and get out, run in and get some tea and get out, right? You're not just like hanging out in the aisles, because you will look like you hang out in the aisles, and you will have disease like you hang out in the aisles.
So now one of the things that you'll pass by in my local supermarket, if I head to the perimeter, I have to make sure that I bypass the bakery.
That bakery, yeah, that sometimes is over there by the produce, and they make it smell so good. And I really think that, they put the vents so that it goes into the parking lot. So you go with the baked goods, right?
True.
And so always go to the supermarket full. Do never go shopping for food when you're hungry, because you will stop at the bakery aisle. You will stop at the bakery. You'll pick up something. It smelled good. You smelled it all the way before you even came into the supermarket. And then that's how they get you. So make sure you're full when you go shopping. Yes, you will make wiser choices.
That aroma is called subliminal seduction.
Yes, it is.
All right. How accurate are at-home A1C test kits as compared to that taken as part of a physician's blood workup?
Depending on the test, it may be 25% off with regards to your A1C. You're probably, if you cannot get to your doctor and that's your option for an A1C, then by all means use that as your A1C. The store-bought cholesterol test, A1C test, you can actually look at the box and it will tell you how accurate or inaccurate it is. So if it says 25% plus or minus, so say it tells you that your A1C is 7 and it's 25% off. Well, your A1C could be 7 point, I have to do my math, maybe 7.3, or it could be 6.7, right? 6.7 is great. 7 under is where we want it. But if it is erring on the side of being higher than the actual test is, then that's a problem. But if that's your way of testing, I have no problems with that. And you want to follow your trend, right? And so it's not just one test in time, it's one test, and then you continue to follow that test. You're testing your finger sticks. So if you're using that in combination, that's absolutely fine.
So now, how important is it to test every day?
It depends. So if your A1C is 6.5 and it's been 6.5 for the past 3 years, then testing every day may not be necessary for you. If your A1C is 10, you need to test every day, because you need to figure out what you need to do to get your A1C down to 7. And again, we'll talk about this a little bit more, but if you're on insulin, we want your A1C under 8. And the reason we say under 8 for insulin is because we don't want you to become hypoglycemic, meaning that your sugar drops below normal. So when your sugar drops below normal, you may feel, again, tired, jittery, comatose, if it drops really, really low. So for diabetics on insulin, A1C should be under 8. Diabetics without insulin, A1C should be under 7. And so the key is to test until you can get to goal. There are some tests on the market called Dexcom 6 and Freestyle Libre. I absolutely love both of them. Freestyle Libre is on the arm, the Dexcom 6 is on your abdomen, and it gives you a constant read of your blood sugar. Whether you're asleep and you're checking it or not, we can tell where your blood sugar is. So I have found that it gets diabetics to the goal faster than anything else I've ever seen, because that if you eat, a bowl of grapes, that your sugar just shoots up. That if you eat, a plate of broccoli and fish and maybe some string beans, that your sugar really doesn't rise very much at all. So it teaches people how to manage their diabetes, because you know where your sugar is all the time without having to prick your finger.
So this person says, why would you test your A1C every day if it is a 3-month average? You're not testing your A1C every day.
Right.
Go ahead.
Right. You're not testing your A1C every day. You're testing your finger stick, and that's your glucose, what we call your random glucose. So you're checking that throughout the day. It's fasting glucose if you check it in the morning. So that's just telling us where your blood sugar is that day. Mm-hmm. The A1C is a test only 3 months to tell us where your blood sugar has been for the past 3 months.
Mm-hmm. How many glucose tests should you do in a day?
Depends. And so if you are just on oral medication, you may only need to test once a day. And again, once your sugar has been controlled for years, you don't need to test every day. You know what to eat. You know how to manage your blood sugar. If your blood sugar is erratic, up and down all day long, then you'll need to test. So when I have patients who are on insulin, they have to test prior to giving themselves their insulin dose. So if they're on insulin once a day, they're testing once a day. Insulin twice a day, they're testing it twice a day. If they're on insulin 3 times a day, they're testing 3 times a day. So it just depends on what medication you're on and how well controlled your diabetes is. And that you'll follow up with your primary care doc and your endocrinologist with regards to how often you test your blood sugar.
Mm-hmm. I want to put a pin right there and also just remind everybody, it is so important for you to have a relationship with your doctor, that if you are diabetic, that they help you find the best endocrinologist. Why? It needs to be managed. It's not that it's got to be a calamity situation, but it's going to keep you here longer. And the more you have discussions, conversations with your doctor about what you can do to help yourself, the longer you'll live, the better your life will be. And that's what you want. You want better quality of life. Is that right?
Absolutely. You know, it depends. You know, some people just want to live long. They don't care how they feel. You know, for me, I want to feel good for as long as I live. And hopefully you have a good primary care doc who manages diabetes well. So I think I manage diabetes better than my endocrinologist do. So I rarely use an endocrinologist. The only time I generally use an endocrinologist is if they're going to use an insulin pump. And so if you're on an insulin pump, and very few people are, most type 1 diabetics will use an insulin pump, then I refer out to endocrinology, but I get my A1Cs down better than the endocrinologist. You know, the patient may come from an endocrinologist and they'll say, you know, okay, 8 is fine, but you're not on insulin. You know, that's not fine for me. So the reason the number is 7 is because all of the evidence shows that you are at increased risk for renal disease, peripheral vascular disease, ocular disease when your A1C is over 7. That's why the number is 7. And that's why you have to know your A1C. If your PCP does not manage diabetes, then they refer you out to the endocrinologist to manage your diabetes. Mm-hmm. And so the key is the number for your A1C is 7 if you're not on insulin, and it's 8 if you are on insulin.
Remember those numbers, write them down, please. What if you are off medication? Do you still need to test daily? Errol wants to know that.
No, Errol, if you're not on medication and you know that for the past year, your blood sugar stays, you know, under 130, 120, then there's no evidence that shows that if you're testing more frequently that you're going to have a better outcome. So again, it depends on where your blood sugar is, right? If you stay like this, you may not need to test yourself every day, right? If you're well-controlled diabetic. If you're like this, you need to test yourself at least once a day. So it just depends.
All right, we're going to move on, but I do have one more question and we'll hold. Well, no, let me ask that right now. Whoa, this is where we're headed. This is so on time. What should your glucose numbers be on a daily basis when you test?
So glucose numbers on a daily basis. So for people who are not diabetic, it should be anywhere, depending on whether you listen to the American Association of Endocrinologists or if you're listening to the American Diabetes Association. Endocrinologists will say 170 to 110. The Association of Diabetes will say that it should be between 80 and 120. All right. So you're thinking anywhere between, generally, I say 80 to 120 for a normal blood sugar, no diabetes, not on any medication. It should be 80 to 120. You're going to fine tune that with your physician as to where they want you to be. And they will be looking at your trend for your blood sugar, right? So if your blood sugar goes up and down and you're at risk for hypoglycemia, right? So you're at risk. So sometimes it's 40, other times it's 240. Then they may keep you a little bit higher for your blood sugar, right? So if I know that you have a propensity to drop your blood sugar down to 40, then I'm not going to keep you on what we call tight control, right? I may let you coast up a little bit, 170, 180. It just depends. And so that you will definitely fine tune with your primary care doc, with your endocrinologist, whoever is managing your diabetes. But generally for diabetics, for most of my diabetics, an A1C, so let's talk about this, right? An A1C of 7 means that your average blood sugar over the course of the past 3 months has been somewhere between about 140 to 170. All right, so that's what we consider controlled for diabetics. Most of my patients who are well controlled, well, if they see 140, they're going to say, oh, that's high, that's really high. But an A1C of 7 generally means that your average blood sugar has been somewhere between 140 and 170, right? So that's coasting up a little bit higher than normal, what we call a normal blood sugar. So the normal A1C is 5.6, right? People who don't have diabetes, the A1C is 5.6. We get into pre-diabetes, which means that you have a propensity to develop diabetes. So for pre-diabetes, the average person with pre-diabetes becomes a diabetic within 2 years. So that's your warning shot, right? That's when you say, oh, no, not me, right? When your A1C is somewhere between 5.7 and 6.4, that's your warning shot, right? There are very few accidents in life. Almost everything that happens has a warning, right? So this is your warning to say, I don't want diabetes. And I tell my patients, if you come in with diabetes, I'm giving you 3 medications. I'm going to give you a medication to lower your blood sugar. I'm going to give you a blood pressure medication that will protect your kidneys, and I'm going to give you a cholesterol medication. Once you get diabetes, you have to be on those 3 medications. So say you're floating around and everything's fine. Now you come up with an A1C of 6.5. You have diabetes, right? So at a minimum, I have to give you 2. So I have to lower your cholesterol and I have to protect your kidneys, right? So I have to give you 2 medications. If you're well controlled, I may not need to give you anything to lower your blood sugar. You get up to 7, 3 medications, right? At a A1C under 8, it means you're on diabetes plus additional medications. So you have to know your numbers. Take the warning shot of pre-diabetes to say, this is not my path. This is not where I want to go. I can control this. And, there's something in the Bible. And if you just like Google Bible verses that have the word tongue in them, it's partly, what goes into your mouth, they say, is not as important as what goes out. And controlling your tongue is one of the hardest things that you can do in your life. And that's there, right? And is, since the beginning of time, probably we've known that controlling your tongue, whether it's controlling the things that you're putting onto your tongue or the things that are coming out of your mouth as a result of your tongue, is the major issue for most people. So if you can control your tongue with regards to diabetes as to what's going into your mouth, we can better control your health. And then, of course, what goes out of your mouth is important as well.
I got to tell you, I remember being told that I was pre-diabetic, but I don't think I wouldn't say took it serious, didn't understand the severity of it. I knew my mom was diabetic. I knew that her mom was diabetic. Why didn't it hit me that I would be perhaps genetically predisposed to contract diabetes? So when you don't have those kinds of conversations, you put yourself at risk. So
Yes.
That's why I'm saying you got to have the conversation and you got to know your numbers. We've got a couple of questions, Doc. I know it's not time for that yet, but I'll hold off until you finish. Go ahead with the medication and treatment.
Well, this part is pretty straightforward. There are certain medications, your physician will determine which medications they're going to put you on with regards to oral medications. Metformin has a bad rap. Metformin is one of the safest diabetes medications we use. We use it even in pregnant women. And there are very, very few medications that we call safe in pregnancy. And so metformin works well. If you have kidney disease, you can't use it because it's cleared through the kidney. It does not damage the kidney, but it's cleared through the kidneys. And so metformin is usually the first medication that's started, and then there are other oral medications added on to that. There are injectable medications now that are used that are non-insulin medications. They can help with weight loss as well as controlling your medication. Some are, as are injected as little as once a week. And so that's helpful. They're very expensive, so your insurance company may not pay for it. And then there is insulin. When the A1C is 8, 9, 10, and anything above that, insulin is your best friend. Insulin is the medication that's going to get your blood sugar down. Your goal is to be on as little medication as possible, whether it's oral, injectable, or insulin. Your goal is to control your diabetes as much through behavior as you possibly can, so that you work with your medications so that the medications don't go up and up and up. So diet and exercise, we talked about vegetables and protein, that becomes your mantra with diabetes. And so Thanksgiving is next week. So if this is your plate here on the right side, you don't have to look like you're starving, so you can have a big plate of food. Half of it at least should be vegetables. And then you put whatever your fish, chicken, eggs, cheese, meat. If you want animal protein on there, you put that on there. You put your turkey on there, whatever you want. And then no more than a quarter of your plate should be the macaroni and cheese, the rice, the potato salad, candy yams. That takes up the smallest portion of your plate. You can have it, right? And understanding that you're going into perhaps a big meal, those 3 or 4 days beforehand, you are just being good. It's vegetables and protein, vegetables and protein. And those 3 or 4 days after, you drop right back into vegetables and protein, vegetables and protein. So there is no food you cannot have. Everything has to be in moderation. So we're increasing vegetables and protein. We are decreasing bread, rice, pasta, potatoes, and we are virtually eliminating sweet foods and sweet drinks. So say you're eating great, right? And you're eating vegetables and protein most of the day, but you want to drink soda, you just messed up your whole day with a can of soda. And so, you want to stay away from things that have no nutritional value and that just mess up everything you've already done. It messed up your diet, it messed up your exercise, just with, a cup of sweet, whether it's juice or soda. Juice is pretty much the same thing, pretty much very high in sugar. With regards to fitness, 150 minutes of exercise per day. So that's 30 minutes, 5 times a week. So, if you're exercising, walking, gardening, walking the children, grandchildren someplace, that's your exercise. That's how you move more. So movement is essential to life. The more you sit, the worse you will be, and the less you will be able to move. So just keep moving, keep moving mentally, physically, spiritually, and that's how we stay healthy.
So Doc, a couple of things here. Takes 2 years if you've been diagnosed as pre-diabetic before you will really cross that plank.
Not necessarily. Some people can do it in 3 months, but the average person goes from pre-diabetes to diabetes within two years. But if you're just really, I have seen people go from an A1C of 7.1 to an A1C of 13, or an A1C of 13 to an A1C of 7.1. And, life happens, right? And some people use food as a way of consoling themselves, right? So say a major trauma happens and you find that you're craving, sugar, sweet, you're not moving, you may be down or depressed, and you're eating a lot of foods that you shouldn't eat, and you're not moving in combination, that's what takes you from pre-diabetes to diabetes, or controlled diabetes to uncontrolled diabetes. And then you have to say, look, snap out of it. I'm going to get some help. I'm going to get help mentally, physically, spiritually, financially, every kind of way, to move myself back to a way of getting out of the way of self-harm and getting into the way of wholeness and healthiness.
You just said something right there that is real key. And if anybody knows me, they know I'm getting ready to hit on the mental health piece of this. You just said very clearly, very swiftly, that it's okay to get some help. And sometimes we do need help with food.
Oh, we do. We
You
do.
know,
We need
we
something to
do.
take us out of the habit, right? So, and somebody say, look, get all the stuff out of the house, right? You can't, if you're not supposed to eat it, don't bring it in the house. If you're not supposed to drink it, don't bring it in the house. If you're not supposed to do it, don't bring it in the house, right? Because you have different parts of your brain that will speak. And I know sometimes people feel like, it's like, I'll give you a scenario, right? It's like 10 o'clock at night, right? Or maybe even 12 o'clock at night. And you're like in bed or on the sofa and you're like, oh, boy, I want that, right? Next thing you know, you're walking to the kitchen and you're like, I know I don't need that, right? And you keep walking to the kitchen because you just can't stop, right? And then you get to the kitchen and you're opening up the cabinets. I know I don't need that. Or you know that there's something there that you want, right? And you find it and you're constantly saying, I know I don't need that, but you're still moving towards it, right? The amygdala is the portion of your brain, right? Sits deep within the brain. Your amygdala controls your cravings. Your amygdala is much stronger than what we call your frontal cortex, right? This portion of the brain. Your frontal cortex tells you what's right and what's wrong, right? So as you're walking to get something that you know you shouldn't have, that's your frontal cortex that's telling you, you shouldn't have that. You shouldn't have that. Don't do that, right? But your amygdala sits deep within the central portion of your brain, and it is strong. It is stronger than anything, any other portion of your brain. And it's controlling your cravings and it's telling you to go get it. And you will go get it, right? If it's there, you will go get it. I love potato chips, right? I don't buy the big family size bag of potato chips, right? So if I want potato chips, I'll buy, the expensive little tiny bag, right? Because then I eat it and I'm done. If I buy the family size bag, I am going to eat the family size bag of potato chips, right? So don't tempt yourself beyond what you can control. That is the key. Right. So plan, you have to meal prep, you have to plan, you have to plan out your whole week of food. I plan my whole week of food, right? Because if I get to, Thursday, Friday, and I don't have any food, I'm going to eat out. And if I eat out, I am not eating as healthy as I would if I had prepared my own food. So it's just really essential to plan, understand your brain, right? Understand what your triggers, what you can control, understand your triggers. You have to understand those things. And that's how you become successful. And it's trial and error, right? And you need people to help you. If they're not going to help you, don't tell them. But if they're going to help you, tell them, what you need as far as helping you out.
We talked about soda. We know that water is the best drink for us, but some of us don't like water. Can you suggest another thing to drink?
Begin by diluting your substances, right? Now, soda is not going to taste good if you dilute it with water. So if you begin by, say you have juice, right? Begin diluting your juice. Say you like orange juice, right? In the morning, you want a little glass of orange. Now, the original glass of orange juice was this big, right? A juice glass is this big, right? Now we supersize everything, right? Juice glass is this big, this round. And so go back to a smaller glass, put this much juice and this much water, right, to begin with. So what you're doing is you're diluting it slowly. And if you do that slowly, you will get away from the desire for sugar. You can get away from the desire for salt in about 6 months. So if you cut out salt in your diet, what you will find is that 6 months later, all you want is like food that's not so salty. You go out to the restaurant, everything is too salty. And it takes about 6 months to do that. Sugar, it takes a lot longer. Sugar is an innate taste for your body, right? So a mother's milk is creamy and it's sweet. So therefore, infants come out liking creamy and sweet. If the mother's milk was salty and bitter, all the kids would die, right? Because they don't want salty and bitter, right? They want creamy and sweet. And so that's your innate taste bud. And so in order to get away from that, it takes a lot longer than getting away from salt. Right. So it might take you 2 years to get away from sugar. So you do it very slowly. Right. So my coffee, when I would drink coffee, I like to have coffee with sugar and a little bit of cream. Got rid of the cream pretty easily. And then I just started having less and less sugar. And then I put a little vanilla extract. I put a little cardamom in there. So I made my coffee like a chai spicy coffee. And that's how I slowly got away from sugar and coffee. And now I just drink tea and honey. And I try not to make that too sweet. But you do it slowly. Work with yourself. Be patient with yourself. You're patient with others. Be patient with yourself.
And since we're talking about juices and sweetened and creamy, should we be concerned with sugars in milk for toddlers? That's one question. Also, how much juice should we really give our kids?
Children should not have juice. Thirsty people drink water, right? Children should not have juice at all, because then they develop that taste for sugary drinks, right? Give them water, right? And so, my daughter would always say, I want this, I want that. I'm like, thirsty people drink water, right? If you're super thirsty, you're out in the middle of the desert, you're out in Orlando in July, right? And it's hot and you're dehydrated. You want water. You don't want sugar, because sugar does not quench your thirst. Thirsty people drink water. That's what you tell your children, right? So if they say, oh, there's nothing here to drink, there's plenty of water over there, right? So you train them in the way that you want them to be for every single aspect of their life, right? If you want them to be upstanding individuals who don't do this and don't do that, then you don't show them that, right? You show them the opposite of that. If you don't want them to develop diabetes because you know their risk of diabetes is high, then you give them lots of vegetables as infants, right? You start them off the right way. You're giving them vegetables, right? You're not giving them a lot of starch. You're giving them water instead of juice. I wouldn't introduce soda at all, so if they get to be, 18 and have soda, that's on them, but that's really, really the key. And you had a second question, Mrs. May. What was your second question?
So I'm not sure. I think you answered it. No, you said about the juice. Should we be concerned with sugars in milk for toddlers? Things like Pediasure filled with sugar.
Yeah, Pedialyte. So Pedialyte is when you have to replace the electrolytes, right? Your child is dehydrated, they have a cold, you got to give them that's what Gatorade, Pedialyte, same thing, right? That's salty and sweet, right? So if they have a deficiency and they're becoming dehydrated, you want them to retain fluid, just like I told you how to retain fluid and how not to retain fluid in adults. Sugar, salt, and starch makes you retain fluid. Same thing for every aspect of your life. So Pedialyte is sweet and salty. Gatorade, sweet and salty. If you're not losing an excessive amount of fluid, you don't need either one of them. So with regards to formula and foods that you give children, breast milk is always the best, right? So if it's, cow's milk, breast milk, soy milk, breast milk. I go for breast milk, right? Because it is the healthiest meal that you can give an infant. And I'll give you an example, right? So infants that are fed breast milk, right? When the stool comes out, there's less stool, doesn't smell at all, right? Because it's the right thing that's supposed to be going into their system. And then you have mothers that wean their infant. Next thing you know, there's copious amounts of stool and it stinks, right? That's because it's not what the infant actually needs. And so breast milk is best.
Okay. All right. But we do understand that a lot of moms may not be able to breastfeed, and you have to do what you have to do, but still stay away and keep them away from those drinks, those juices. Is it okay to add fruit to water, i.e. pineapple, strawberry?
Absolutely. So if you're a diabetic, you're not adding a lot of fruit because fruit has sugar in it. But you choose your fruit wisely. So if we look at the carbohydrate content, right? So it's not the sugars, it's the carbohydrates. So if you look at the carbohydrate content of different fruits, you choose ones that are lower in carbs. Citrus, one of your lowest in carbs. Peaches, low in carbs. That's only in season in the springtime. Your berries, your melons, those are the fruits that are lowest in carbohydrates. They will raise your sugar less. Then you get into like grapes. They're going to shoot your sugar up if you have more than a handful of grapes. Bananas, 36 grams of carbs. It is the highest amount of sugar in all of the different fruits. So bananas, plantain, those things you want to pretty much stay away from as much as possible as a diabetic.
Sounds like things with seeds in them are better fruits for us.
Things that have color, more color, right? So the reason foods are white is because of the starch content, right? So if you're going to have, let's do a simple quiz, right? So which one has the least amount of carbs? An apple or a cantaloupe? Cantaloupe. It's colorful. It's not white, right? The thing that makes it white is the starch content. Same thing with beans, right? So if you're looking at the carb content of beans, the whiter the bean, the more carbs in the bean. Black beans have the least amount of carbs, right? So you go black beans, kidney beans, lima beans, chickpeas, right? Chickpeas, hummus, loaded with carbs, right?
Okay.
So you want to go for the darker bean. You want to go for the fruit that's more colorful. And the thing that makes it white is the starch content in the food.
I never knew that about apples, between apples and a cantaloupe.
Take
All right,
cantaloupe.
let's get back to wrapping up our presentation.
All right, so improve quality of life. So access to healthcare is key. I shared with our panel, I came here from New Jersey recently. And so I've been seeing patients in Florida for the past 2 months, 2.5 months. I have seen more amputations in 2 to 2.5 months than I've seen in 20 years. And a lot of it is access to healthcare for the population that I see here in Orlando. Lack of access to caring healthcare. You know, I think it was, I can't remember whether it was Eisenhower, it was before Eisenhower, who said that there's no health in healthcare, there's no care in healthcare. You know, so the key is, you know, putting health and healthcare back into healthcare. And so you have to have a provider who you feel that you can connect with, who is pushing you to get the A1C under 7%, because that's what really, really matters, who's pushing you to have your eyes examined, who's pushing to check your circulation in your feet, who's checking your kidney function regularly, making sure that there's no heart disease. You know, these are the things that we check for and we make sure are fine. But, you know, that's on the healthcare side, and on the patient side, you know, really being proactive, you know, to say, you know, this isn't normal for me. Let me go and see my doctor. And if you're having trouble with that, it's really a matter of finding another doctor at that point. So access to healthcare is important. Prevention and maintenance is important. Behavioral change, you know, it's all about changing the way we think, changing the way we live in order to live a healthier life. Meal planning, we talked about, vital. Like I said, when I go to the supermarket on Saturday or Sunday, I know what I'm eating for the rest of the week. Everything is planned. My meals are planned. My snacks are planned. Everything is planned because I love to eat, and I eat constantly. And when you're eating a diet that's vegetable and protein, you're going to eat all day. You know, when you're eating starch, you know, you fill up and you don't need to eat as often. And so I plan to eat all the time, all week long, and I shop that way. Sleep is important when we talk about stress and sleep. A lack of sleep raises we look at something called your neuroendocrine system. And so your nerves have an effect on your blood sugar. And so when you have a lack of sleep, you're on heightened sense of awareness, you're pushing through the day. So that's going to raise your blood sugar. Physical activity increases your muscle mass, your sugars, your muscles use sugar for energy. And so that's really vitally important. And lastly, having a support system, whatever that support system is, whether it's meditation and you're depending more on yourself and your own wholeness, and realizing that you are whole, right? That there's really nothing that you're generally lacking with regards to who you are as a human being. And then outside of yourself, having that system with friends, family, organizations, whatever gives you that support. There are several resources listed here. I can be reached through Vanzella. Vanzella Randolph is one of our what we call MGCs. She controls our membership growth. If you need to reach out to me, you're a senior, we take patients on Medicare only. So that's generally 55 and older. So 55 to 65 with certain health conditions, and everybody over 65 has availability for Medicare. But please reach out to me. I have a little bit of a window. Pretty soon my panel will be full, but I welcome you. And the American Diabetes Association has lots of information. The CDC has information. If we're looking for information with regards to support and finding mental health support, African Americans don't do that enough. Where you just need somebody to talk to who's more objective. There's therapy for Black girls. So most, if not all, of those therapists are of color. Psychology Today gives you the pictures of all of their therapists. So psychiatry, licensed clinical social workers, psychologists. So for our mental wellness as well, our mental emotional wellness, those are options for you.
Before we go into our last question slide, I did want to say we have a post-test, same 5 questions. Just want to see what you got out of tonight's webinar. Dr. Page, you are phenomenal. And I said this in my Instagram. I said, this lady is the truth. And you are. People are asking, are you accepting new patients? And she just said again, yeah, but the window's going to close soon. So make sure that you get in touch with Vanzella, and that information is there. There were several things that you said that really stood out with me. This is a great, thank you, awesome presentation. We're getting so many kudos. You're getting so many kudos, I will say. I really appreciate the time that you took with us tonight. Tamisha and the team from Center for Change, thank you so much for having us. This PowerPoint that Dr. Page worked with Tamisha on is just phenomenal. Great information. Some of the things that stood out with me is that the amygdala, we have to give ourselves grace because those late night cravings do come, but you have to fight back. You have to. And once you begin to tell yourself no, you'll be surprised how often you will find yourself, okay, have these little conversations with yourself. Listen, it is really mind over matter, and you're going to say, Monica, get out of here. Let me tell you something. I've been told some very serious stuff about my health lately, and one of the things that I wanted to do was try a little bit harder. So I started doing a vegan diet, a simple vegan diet, and there's nothing simple about it, and taking some extra supplements along with I do Zig Duo, not metformin anymore, but there is a little metformin in that, I'm sure. But you got to do something to help yourself. And I promise you, if you take one step, he's going to take a few more steps along the way with you. But you got to get into good medical care. You got to get into the optimal shape that is right for you. That means even if you walk 15 minutes, maybe in the morning, maybe again in the evening, that's 30 minutes a day. That times the 5 days a week, that's your 150 minutes right there. You've got to do something to help yourself. Diabetes can be life-threatening, but it doesn't have to take you out. She said she's seen more amputations in the 2 months that she's been here in Florida. That means that we're not doing the best that we can to take care of ourselves. And you do have wonderful doctors like Dr. Page who are willing to help out. Let's see what other questions that we help. Very informative. I am diabetic and often felt confused. Let me tell you something. This is, that came from Karen. You're right. I learned a lot tonight, and I didn't know how much I didn't know about something that I've been living with for a couple of years now. We've got to get to it. Excellent information. Thank you so much for all of those comments. Are there any other questions that we have? Let me go to the Q&A and see if there's anything there. I think we answered almost everything that we could have come up with. We talked about our body shapes. We talked about that figure 8, that Pepsi Cola bottle. Yeah. Then we also talked about being the apple. My apple's going down. How's your apple doing? Because I know I was heading way in the wrong direction. And she's right. If your midsection is there, come on. We can do this. We can do this. Let's see. Walking around the perimeter of the store, try to stay out of those aisles. The other thing to do, put your list in your phone. Know what you need. and go after only what you need. It'll save you in the long run, your dollars and cents too. If you are diabetic, 7 should and under should be what you're striving for. 140 to 170, that would be your average over a 3-month period. There are some other things. If you're on insulin, you need to stay at least an 8, or below. Those are some things that you have to know about. The lack of sleep. Lack of sleep is so healing. Sleep is so regenerating. You've got to give yourself how many hours of sleep? Would you say at least 6?
It depends. It depends. It depends on how old you are. It depends on how much sleep you traditionally have needed. Generally, a minimum of 6 hours of sleep is going to be important for most people, but it just really depends on your body.
Is there any correlation, if any, with hemorrhoids?
Diabetes and hemorrhoids? No, not really. Only in the sense that if you eat a high carbohydrate diet, carbohydrates pack up your stools, right? So if we have a person with diarrhea, we tell them to eat what we call a BRAT diet, B-R-A-T. That's bananas, rice, applesauce, and toast, right? So we're giving you rice, we're giving you bread. We're trying to bind up your stools. And so if your diet is full of those foods that bind up your stool, then you're going to have more constipation. So I generally tell people, right, if you can take a food, right, and you can ball it up like this and roll it across the table and it just rolls and it doesn't unwind, then that's what it's going to do in your system, right? But you can't take like broccoli and do this, right, and roll it across, it won't roll, right? But you can take bread and roll that across the table. You can take a banana, roll that across the table. You can take rice, into a ball and roll that across the table. So if you can do that with your food, it will do that in your system. And so that would be the combination. The other issue that happens with diabetes is that not only is it affecting the nerves in your legs and every other place in your body, it's affecting the nerves inside of your intestinal tract. And so foods will not move through. We call it gastroparesis. And so gastroparesis is where you eat and it just doesn't feel like the food is moving through your system properly. And so it's damaging the nerves inside of your digestive tract that moves your food along the pathway. So in that sense, it can lead to poor digestion, slow transit, right? So things move through your system a lot more slowly. So if you're going to speed that up, you're going to cut out starch, you're going to cut out things like red meat. Red meat is very difficult to digest. And you're going to have a lot more vegetables, nuts, things like that will move through your system.
I've got a friend right now who is an overnight truck driver, and he wants to know the best food to eat while working overnight. Good question.
Vegetables and protein. So if you're going on, say, a long drive, right? And in the past, you might have things like potato chips. What else is on the road? Honey buns. What is that? I can't remember the name of that store. That's because I don't eat there too much. So you may have bread, you might have hamburgers, hot dogs, things like that. Those are all going to make you sleepy, right? So whenever you eat starch and sugar, it's going to make you more sleepy, all right? And so if you're an overnight truck driver, the last thing you want to eat is starch and sugar. So you're eating your nuts, you're eating your vegetables, you're eating like foods that aren't going to weigh you down and make you sleepy. I tell people that sugar makes you stupid, right? And so one day I'm in my office, I'm rolling around, right? I'm typing, 100 words per minute, talking to the patient and taking notes at the same time. And this pharmaceutical rep comes in with some oatmeal raisin cookies, right? My favorite cookies, right? So I had 2 of them. I go back in the room to start seeing patients and I'm not doing this anymore. I'm like this, right? So I turned to the patient. I said, you know what? Sugar makes you stupid, right? I just could not function the same way. I slowed down immensely. So if you're an overnight truck driver, stay away from sugar, stay away from starch while you're driving. get your vegetables, whether it's like if you have to eat raw vegetables and crunch on those, finger foods while you're driving, have your nuts, almonds, walnuts, pecans, and that's what you're going to eat. If it is a fruit, it should probably be no more than a tangerine or orange or something like that.
Well, I do want to say thank you very much. We do have that poll that we do want you to respond to. So if we could just put that up on the screen and get our responses to that. Also, again, Dr. Page, there was a number that you gave us. We can still talk about that in order to reach you or your scheduling person. If you could just share that one more time.
Let me see. Let me find her number. I'm looking as we look. I'll give you the number to the center if you don't have that number. And when you call, just ask for Vanzella. You're trying to reach her
in
order to get
put it in the chat. Put it in the chat.
I'll do that.
So again, on behalf of Center for Change, we say thank you very much for spending your entire evening with us, all right? What you should know about diabetes. This has been so informative. I just have to tell you, very interactive as well. As we said, it would be. This is maybe our 4th webinar that Center for Change has done. And I just love the fact that they involve so many community physicians to do it. I am Monica May. I've been your host, and it's been my pleasure to be a part of the Center for Change webinar on what you should know about diabetes. Give yourselves a few moments more with the post-test, I should say, what you should know about diabetes. And Dr. Page, we thank you so much. So she's put her information in the chat, and you're going to dial 407-906-0082, and you're asking for Vanzella.
Yes, and thank you, Center for Change, for hosting a wonderful event. You're just so professional, and it's been an absolute pleasure to work with everyone from the center as well as Mrs. May. Thank you all very much.
Thank you so much, Dr. Page. And Maria says, thank you so much, Dr. Page. Thanks, Center for Change, for always doing excellent work, and we appreciate you so much. So we'll leave you with that poll right there. Tamisha, you let us know when you think we've gotten just about everybody. So we'll do one more minute on that poll. And thank you guys for just hanging in there with us all night.
And it looks like you all are answering beautifully. It looks like a few more people need to answer. You're at 100%. I think that's absolutely fantastic. Everyone is getting all the questions right. So congratulations.
You did your job. You did your job.
Congratulations. Come on, a few more people. We have a few more people that just need to answer those questions. Fantastic.
We just had about 85% participation. We want 100. We know we can do it.
Very, very nice. Well, I wish everyone a very healthy and safe and enjoyable Thanksgiving. Enjoy yourself, enjoy your family, enjoy your food, and do it in a way that you'll be happy that you did it that way.
Mm-hmm. Try something different.
Yeah. Well, I will say thank you to everyone. Have a beautiful evening and stay well.
That's right. Thank you so much. And I will do the same, and I'll leave you in the good hands of Mimi from Center for Change. And we're just about wrapping up the post-test. Dr. Page, it was a pleasure working with you.
You as well. I enjoy it. Let's do it again.
Thank you. I'd like that. Good night, everyone. Happy Thanksgiving.
Thank you and good night. And thank you, Dr. Page and Mrs. Monica.